For those of you that don't recognize my voice, this is Adira Levin. I'm the named co-PI of the CanSolve CKD network. On behalf of everybody, I'd like to acknowledge that we're hosting today's meeting on the traditional unceded territory of the Coast Salish peoples, home of the Musqueam, Tsleil-Waututh, and Squamish First Nations. And importantly, in Vancouver, we have the core team, or part of the core team here, and I will have them each introduce themselves and their roles so that people know who's here. Starting with Graham.
This is Graham Pollock. I'm the Communications Manager for CanSolve.
This is Amanda Green, the Administrative Assistant.
This is Grace Jawood, Finance Manager.
Linnea Franson, Communications Coordinator.
Heather Harris, Executive Director.
And then I pass it over to the other members of the core team. Braden.
Braden Mans, I'm in Calgary, one of the co-leads.
Great. And is Jim on the line?
Yes, Jim Scully here. I'm here in Toronto, one of the co-leads.
And Selena and Helen, can you introduce yourselves? And Leah?
Selena Alu, Knowledge Translation Broker based in Calgary.
And Leah? She might not be on, but Leah is our administrative lead of patient engagement. There are two patients also on our call, Mary and Kathy, and I'll have them introduce themselves as well.
Kathy?
Hi,
Or Mary, whoever.
Go ahead. Hi, it's Mary Bocage. I'm a patient partner in Nipissing First Nation, which is just outside of North Bay, Ontario.
Hi, everyone. It's Kathy Woods. I'm a patient partner and I reside in the Treaty 1 territory in Winnipeg, Manitoba.
Great. So this is our 2019 funders forum. I won't go through asking all of our funding partners to introduce themselves, but I do want to actually acknowledge, and if those of you that can see the slides, the totality of the people who are helping us to do this. And this includes our industry partners, our university partners, our health authority partners, First Nation Health Authority, and others. And I think it's very important to realize the diversity of the kinds of support that we get, as I said, from ministries of health, academic institutions, service institutions, as well as industry partners. So for today's format, what I'd like to do is start by asking Mary to give us an overview of the Patient Governance Circle update, and then Kathy to look at IPERC update, and then myself, Jim, and Braden will take us back on some reflections as well as forward planning, and hopefully we'll have some time. In fact, we encourage some time for you as our funding partners to ask questions. So with that, I'm going to turn over to Mary for our Patient Governance Circle update.
Thanks, Adira. As you see here, our first slide is a picture of the members of our newly formed Patient Governance Circle. If we just want to go to the next slide, we can just go through some of the highlights. So in terms of our first point, we started meeting last fall to reflect on how the Patient Council looked in 2018 and how it would evolve in the future. Our membership was growing, and with the emergence of the Regional Patient Network and Kidney Link, we knew we had to re-examine what patient engagement looked like. We compared it to choosing your own adventure because we were finding that patients wanted varying degrees of involvement. It was identified early on that we needed more robust advisory circle. We were 5 patient voices as the Patient Council executive, but we grew to 12 to 16 patient advisors with the evolution of the Patient Governance Circle. We will have our first meeting, in-person meeting in Vancouver in October. We have 14 projects with a designated patient lead, which is a 100% increase over 2017, 2018. And we've seen the evolution of the relationship between researchers and patient partners. We've had patients, co-authors presenting at national and international conference. We had a huge presence at the SCORE Summit last October in Ottawa, where we were involved in various presentations from keynote panels to poster presentations. Our posters have been very well traveled this year, having been to the ISN WCN in April in Melbourne. CSN in May, and we are looking forward to attending the ASN in November. Excuse me. Patient involvement through peer review through the Research Operations Committee. We've had a lot of new patients come on board and give us more input as to how the inner workings of the projects are going along, and actually learning a lot more about that aspect of it too. There was a national task force on patient compensation. We collaborated with other SPORE networks to create a document looking at patient compensation, and we are looking to implement those guidelines with our own patient partners. In the winter, we crafted a response to the CIHR ethics guideline and asked for a meeting to discuss our response. We had a productive discussion with CIHR that led to some follow-up after. And I'll pass it over to Kathy.
Hi, everyone. I just wanted to draw your attention to the logo. That is one of the things on the page, if you can see it, for those who can. That was one of the accomplishments that we worked on, was that we got a logo, and we're actually quite proud of it, and we're going to be using it on all of our material that's going out. During this time too, we also developed a strategic plan. We had a strategic planning session in Winnipeg in March, I believe, beginning of March. And so we've developed a strategic plan, and we're just continuing to develop that plan with a bit more focus on sustainability and how do we continue to move forward. The continued development of Wabashke Bijigo Scanch, our learning pathways. We're working on the Elders in Research and the Indigenous Research and Ethics Protocol through the great work of Helen Robinson Satie and her co-leads, people that are working, Catherine Turner and Dr. Malcolm King, who are working on these specific projects. We've increased representation on the research project, which is one of our goals, to be able to ensure that most of our projects have an Indigenous person sitting on the research project. Also, in terms of that, we're looking at expanding. We've had a couple of folks step back, so we're actually looking for IPERC representation, Indigenous representation in the East, and we're also looking in Alberta and Saskatchewan for some Indigenous patients and caregivers to step forward to be involved in IPERC. We've participated in many national and international conferences that are focused on Indigenous health. Some of them Mary's talked about already. We attended the World Congress in Melbourne, Northwest Territories SPORE Support Unit in Yellowknife, the CRHR Indigenous Gender and Wellness Fair, the SPORE Summit, which we were well represented. And Helen and I have done a couple of presentations at First Nations Health and Social Secretariat here in Winnipeg. So that's about it for the IPERC update. Like our main focus is going to be how we're going to move forward, a mentoring process to bring new members on, and just looking at further expansion as we move forward. Thank you, Miigwech.
Thanks, Kathy. Oh, so my role is to sort of take you through some of the highlights and re-emphasize some of the things that Kathy and Mary have talked about, but in the context of some of the building blocks. So as you know, in order to truly engage patients, researchers, and families, as well as policy, we really need to develop our curriculum. So as Kathy already explained to you, we certainly have our the Indigenous learning pathway called White Horse that she already talked about. But as well as that, we have something called Kidney Pro, which promotes kidney research in Canada, curriculum for researchers and patients, but particularly aimed at patients to really help them understand the principles and procedures that go on to being involved in research. And that really is an important set with 5 new modules. And then they're listed here on the side, the tools that enhance patient engagement, telling stories with impact, and then the other 2 that I've spoken about already, as well as the integrated knowledge translation, which Selena has been instrumental in facilitating and really has a major impact. Telling, as many of you as funders, CIHR, and policymakers will know, telling a story with the appropriate ability to describe what the value of this particular project is a skill and needs to be enhanced so that we can increase uptake into clinical practice as an evidence-based development. And this is a really important skill set. As in terms of capacity building, we actually have 2 components amongst many. One is the CNTN, and the other is, which stands for Canadian Nephrology Trials Network, and the other one is Kidney Link. The CNTN had a vision workshop and has developed a new committee structure to serve the Canadian nephrology research and general community better. And we've actually developed something called the Kidney Link portal that connects patients to a number of different research opportunities, and I think this is quite exciting. Just a few words about Kidney Link. It's an online platform that allows people to self-identify as a patient, researcher, policymaker, etc., and allows you to see what's going on in the research world in kidney disease across Canada, not just in terms of clinical trials, but opportunities as well for learning, etc. The idea is that with an increasing groundswell of people understanding research, we'll be able to increase people's ability to participate as well, and ideally help the researchers to recruit all the patients that are interested for both cohort as well, observational as well as interventional trials. And I think this is something that really does change the landscape in a real way. It as well gives us some metrics that allows us to say how many people are joining up, and ideally will serve us well from that perspective as well. So just a little word about CNTN. It's a pan-Canadian network that is intended to advance multi-center prospective research, particularly randomized controlled trials, but also looking at newer platforms and innovative trial design and how we might get that into normal parlance, if you will. We already have a great collaboration across the country, but this actually promotes it even more. And ideally, we're also offering resources to help conduct these clinical trials and overcome some barriers to recruitment, especially as identified by the patients who want to know why they're not allowed to be involved in certain things. We'll just go on to the next slide. And with respect to knowledge translation, again, which Selena has been leading along with others, we've developed a KT community of practice, which is a virtual working group that allows a better reporting on project outcomes, what I was talking about before. How do you best make sure that the people that you're talking to understand why you're doing something, what you're going to find, and how that will impact people? And we also have a Canadian Chronic Kidney Disease Clinic Network, which is a national initiative that allows people across the country to be connected, all of whom are trying to deliver to pay care to people not yet on dialysis, which is, as you know, a place where a lot of some of the prevention and delay of progression trials are going to occur. And there's an ongoing webinar series that everyone's welcome to attend that should actually increase our knowledge there. So I'll remind you as the funders and supporters of this network that we have 18 projects across 3 main themes: earlier diagnosis, better treatments, and innovative care. There's some obvious synergies between them, and we've identified some of those at our most recent meeting at the CSN in May, which is, I think, going to be very fruitful. We have so far in this academic year 14 peer-reviewed publications in good to very good scientific journals. And we've actually presented more than 50 abstracts and conference presentations in this last year, which means that the people that are doing the work are actually busy publicly presenting it, so it's out there in the public domain, which is, as you know, part of the way that one does change culture. I'm just going to spend a little bit of time on a couple of projects. Kidney Check is our diabetes, blood pressure, and kidney health checks and care in Indigenous communities, which is an attempt to implement a better way of identifying and treating kidney health and treating kidney disease and identifying healthy kidneys in Indigenous communities. This is very much a bottom-up, partnering with communities to develop these kidney health checks with point-of-care apparatus based on local needs and values. The exciting things in the 4 or 5 major provinces that it's getting done in. So it's initiated in Manitoba and launching there and tailored specifically to the needs of Manitoba communities. It's also launching in British Columbia, Alberta, and to some extent Saskatchewan, and has an adapted methodology in Ontario. But I think it's very exciting to see those differences and similarities, but also how much the communities are excited about actually ensuring that they can have a sustainable method of making sure that they know the kidney health of communities. So this is actually, it takes about 45 minutes. There's a consent and registration, blood pressure, finger prick for blood, urine sample, and then there's these point-of-care analyzers. The results are then given, and what ends up happening is that we are able to identify healthy kidneys and not healthy kidneys and ensure that patients are and their primary care providers are given appropriate information at the time of consultation and have access to good consultation as required. The important thing about this project goal is that it affects 3 different levels. Individuals, so that individuals understand how to keep their kidneys healthy or prevent or delay problems. But from a community perspective, it's really important because the community guides the screening, understands the results, and using OCAP principles is very aware how to disseminate the results and keep it important. And from a healthcare system perspective, and we are working with ministries of health in the various provinces, by improving that early detection rate, we should be able to reduce the take-on rate to dialysis or improve access to preemptive transplantation. So I think that's pretty exciting in terms of the impact that this one project will have. The Empathy Trial, which stands for Evaluation of Routinely Measured Patient-Reported Outcomes in Hemodialysis Care, focuses on a small but highly important group of people who are receiving dialysis across the country. And the overall aim of the trial is to make sure that we understand the impact of patient-reported outcomes on the patient experience, how we manage their symptoms better, and how we understand provider experience, specifically in hemodialysis units. The groups that are participating at the moment are the North and South Alberta Kidney Care groups, as well as the Ontario Renal Network. As you can imagine, in all programs, you can't disseminate it all across Canada until you've demonstrated value. So I think this is a good example of an appropriate selection of different provinces participating so that they can inform best care and best practices going forward. The idea here is that there will be practice guidance for clinicians in managing their symptoms, as well as patient handouts, and together this constellation of treatment aids should improve the outcomes of patients who are exposed. If you actually improve the communication between patients and clinicians and demonstrate that you can do this with these tools, it should lead to improved symptom management. While some of you may think that we know this, actually we don't. We haven't proven that these tools delivered in this way with the scripts, et cetera, will really lead to improvement. So I think it's an incredibly valuable hypothesis to test. And just to give you a feel for the project timeline, everything does take an extended period of time. So the planning has gone on in NARP and earlier in SARP, which is Southern Alberta program, still ongoing, and at the ORN started last year, and the implementation is ongoing over the next 2 years so that we can analyze everything by 2020. So in terms of a third project, how we enhance patient self-management of chronic kidney disease, which is a multi-phase approach. This is actually predicated on the fact that self-management supports patients' needs, preferences, and priorities by having comprehensive educational material, which at the current time is limited, and we have never really involved patients to develop these support strategies. We actually change it up in this project and do all of those. So what's interesting is we've got patients here providing input into the study method. So they're actually developing a lot of the personas. They're participating in all of the knowledge translation efforts, including manuscripts and presentations. And they're actually truly at the table with the investigators and study team looking at how best to implement this and actually promoting all of the work that's getting done at the same time as promoting the need for kidney research. So self-management is one piece, and then part of that is also ensuring that people understand how important it is to participate in kidney research. This is just a nice visual. Again, one of the things that Selena helped develop in the context of how do you actually describe to people where we are along this journey. And so this is the description of that particular study, looking at the multi-phases, the timelines, and how you actually get to the end of delivering and evaluating and figuring out what are the major outputs of this particular program of work. So I'm going to ask Jim. So with that, I'm going to stop. And I appreciate that we're doing a lot of talking, but what I think would be important is if we get through the presentation, then we can back up and get questions asked, if that's all right. So Jim, I'm just going to ask you to please go through the financial overview.
Yeah, happy to do so. Thanks, Adira. The first slide represents an overview of the sources of funding that support the activities of CanSol CKD. Embedded within this chart actually is a recognition and a reminder that when the CIHR established their strategy for patient-oriented research program, and in particular when they sought funding for research in chronic disease networks, that it was a one-to-one program, which meant that the investigators had to raise $1 for each dollar that CIHR would provide. In the pie chart, the upper right quadrant, which is in the bright green, shows the $12.5 million provided by CIHR as part of their chronic disease network strategy. And you can see below that in fact, right away, we were able to leverage other CIHR grant competitions in order to expand the CIHR base of our current funding structure. There were two other key ways in which partners interacted, first by providing in cash and second by providing in-kind support. All of these in some support actually all 18 projects and the 5 core infrastructures. If you go to the next slide, you'll see a bar or pictogram which shows in a little bit more detail really the diversity of funding sources, or said alternatively, the diversity of our partnerships within the Canadian communities. Indeed, this represents $24.3 million in non-CIHR partner funding that includes both cash and in-kind contributions. You can see that the largest group, which is shown by the dark blue on the right-hand side, comes from health research funding organizations. This is dominated by the research institutes that support the investigators across the academic institutions in Canada, followed by charitable donations. This includes a terrific partnership with the Kidney Foundation of Canada, but also includes the Juvenile Diabetes Foundation International in New York and provides an international link for our group. University professional associations include, or actually represent a commitment of the physician group that's involved in providing care and performing research, their commitment to the program. And then indeed there were private donors and pharma companies that have played a key role in launching the initiatives. Again, a very broad representation that across the country, but necessary for the support of the Next slide represents the current spending, and for year 3, the CIHR awarded the SPORE networks, including CanSolve CKD, on April 1st of 2016, and over the next period of time, over the next year, there was a tremendous effort to organize and develop the research programs. In year 3, the budgeted spending is $7.1 million, and the actual expenditures are $5.2 million. There's a $1.2 million unspent fund that is being carried forward. This really represents what is the ramping up, if you like, of the research programs, the tremendous investment early on in the administrative and then the challenging contracts and organizational agreements and between the institutions. I think an unanticipated challenge for the research groups, but I think one that a hurdle that we've now cleared in the main, and we anticipate that the budgeted spending and the actual expenditures will close in on one another as we move forward into years 4 and 5. The next slide shows the actual breakdown of the expenditures. So if you look at this slide, starting on the right-hand side, that's the actual in-kind support. And again, it represents about 60 to 70% of the committed dollars of that year in kind. And then the actual cash spending was 75%. And this represents the shortfall from the budgeted of the research and the considerable time that's been devoted to establish a number of sites for many of the projects and to bring the research staff on site. And those delays may mean that actually on the ground the expenditures are rising much more quickly as we go forward. The next slide, the next financial highlights slide shows, I think, some important information, and it really indicates that it really indicates where the money is going that is being spent by the network. And I would emphasize that 68% of the dollars are actually supporting research staff, trainees, contractors, and partners honoraria. And then following this, there are other costs that include supplies, materials, and services, which really are the foundational support for much of the research activities, so that fully 91% of the dollars are actually supporting the activities of the 18 projects and the infrastructure groups going forward. Stakeholder engagement is important. The patient engagement is part of course, the program by name and by fact, and so stakeholder engagement remains a significant part of the budget and a necessary part. The stakeholders are brought together, remain informed and remain engaged, and in fact influence the research process as it moves forward. I think remarkably, considering the scope and size of CanSolve CKD, only 4% of the budget goes to the management and administration. This, of course, underrepresents the impact of the management and administrative team because they're really the glue that holds together the research program and actually provides that ongoing checks and balances that enable us to document our progress as we move forward. Final budget slide is showing next, and I'll go from right to left, and I think this just these pie charts represent the apportioning of money over time. And you can see that in year 1, the largest pie, even at that stage, was supporting the research. And as you move forward, you can see that there's an important evolution and apportioning of the funding. From years 1 to 3, there's an ever-increasing utilization of funds to support the actual research activity.
Oops, you cut out there, Jim.
Sorry?
Did you cut out? Oh, sorry. I wasn't sure if you were finished or if you cut out. Yeah, okay. Thanks.
And again, I think I just wanted to point out an important evolution from years 1 to 3 in the apportioning to those supplies and materials that support the research efforts, and a shrinking budget related to stakeholder engagement and central management. The central management required considerable investment to establish, and stakeholders' roles were established in year 1, and the ongoing support reflects their necessary and commitment to the research effort. So that's really all I wanted to emphasize from the financial perspective.
Thanks, Jim. And Braden, can I ask you to sort of take us through where we're going? And thank you, Jim, for such a succinct overview of where we're at with our dollars.
Sure. It's nice to see all the funders on the line, including Sandia Padmanab, who I went to school with in rural Saskatchewan. So a shout out to her. So I think my job was just to tell you where we're going moving forward. So we're nearing 3 years now. We have 2 years left of funding, and the funding that's left over will roll into an additional spend out year. But the importance is that, as Jim says, we've now ramped up all of the projects, and we really feel like the vast majority of projects are set to meet the deliverables and outcomes that they were originally intended to achieve. Next slide. But that doesn't mean our work is done. This is a 5-year grant with, as I say, sort of a year of spend down. But we think that it's really important from what we've achieved, and that this is the first, large-scale network grant in kidney that we want to sustain this beyond that 5-year time frame. So we've already met as a team in January to try to understand what we need each of the 18 projects and the core infrastructures to be able to give us. It was a year from then, but now sort of in 6 months from now, understand what's been the impact of CANSOLV CKD for patients, for the healthcare system, as well as the usual metrics. And we set out a framework for how we would identify strategic priorities moving past this first 5 years. Next slide. So we've asked the teams to tell us by early next year, they've already told us what they think they can accomplish by 2020. And that, of course, includes the usual publications. But actually, to me, those are not particularly relevant to the funders. I think the funders are interested in the impact for patients, the impact for the health system more broadly. So if we only have publications, and of course we will have publications, but if we only have publications, that probably should be seen as a failure. We certainly, moving forward, while there's been lots of work done through those 18 projects in the core infrastructures, there's lots of ongoing things that can develop out of those. So we want to leverage that work that's in progress. There are, out of CANSOLV, and in fact through the support of the Patient Council, other funding applications have been successful over the past couple of years. And so how do we leverage that work moving forward? How do we establish new funding partnerships? How do we, in fact, continue to work with the core funders that we're very appreciative and have been on board? So we'll be also tracking, in addition to the projects, as I say, the output from the core initiatives. Next slide. So we have a Gantt chart of what we need to do over the next year. We expect there's no guarantee. Well, actually, I think there's a guarantee that there will be some sort of funding call for chronic disease networks, and we would likely see that in the fall of 2020, possibly a little bit longer than that, possibly a bit earlier. We don't know what that call will look like, but we do know that the reason that we were successful in getting funding for CANSOLV CKD in the first place was that we were organized, that we had a very healthy kidney research community, and that we'd already established a couple of priority setting projects working with patients, and in fact partnering with policymakers and partnering strongly with the Kidney Foundation and other funders. And so it was that essentially pseudo network that we had set up at the start, which allowed us to be successful. And so we need to be organized and set ourselves up for success come fall of 2020. So we're in the midst of setting up a planning committee. That's going to be done by the end of this month. We envision a couple of in-person meetings for that planning meeting. We think that there will be a larger meeting of the entire network The planning committee will be charged with developing, or do we just continue to work on our vision? What's our work plan under that? What work are we going to prioritize for funding within that? And how will we vet that through the patients, the patient council, IPERC, through our provincial policymakers, through our funders, so that we support the right work going forward. And I think this may be one of the last slides, if not the last slide, but we certainly want to understand how our funders feel they can and should be engaged in this process over the next year. Next slide. I think that might be it. Yes.
Yeah.
Back to you, Heather and Adira.
Yeah, thanks very much, Braden, Jim, Kathy, Mary, and to all of you that have contributed to this. And so we have about 20 minutes or so, which is what we wanted, to really, if we go back one slide, just to reiterate that we're very excited about the potential for 2.0. I think the Canadian community of patients, funders, and even policymakers at various levels in the provinces are pretty excited about what we can do based on what we've been able to do thus far. And so we really want to hear from you what you think we need to do, how we should do things, and what else we might be able to think about going forward. We have a federation in Canada. It's hard to get some things done because of various provincial and other politics, if you will, but I think that the Canadian community for kidney health has really come together to try and get through some of those barriers. So maybe I'll just open it up, and maybe Nancy, I'll put you on the spot, since I know that since CIHR is the catalyst for all of these SPORE networks, perhaps I could ask you if you have any top of mind questions or issues or comments even.
Thanks, Adira. Thanks for including us in the Funders Forum discussion. I've gone through the report to the community, and it looks fantastic. I think the slides that you're presenting to the funders shows the high level of transparency and accountability that this network is showing, so thank you for that. I do not at this time have any updates with regard to what people are labeling as SPORE 2.0. Other than to say we continue discussions around planning for the next phase of SPORE. It will not be held up necessarily in the context of the CIHR strategic planning. That is a common question that is coming out at this point. The strategic planning will help frame things moving forward, but we also recognize that with SPORE, there's been a lot of discussions happening already to date prior to the development of that strategic plan. So it has been agreed that we will continue to move forward. So things like the next phase of the support units, for example, that funding opportunity will be released shortly, and probably early October. Information has gone out to the support units themselves on that front, as well as funding partners. We have had some conversations around networks, but we haven't come to any definitive answers on that front. We've stepped into the performance review, or the review of the performance reports that have been submitted by all of the networks, and have spent a significant amount of time this past summer going through those, and are now presenting that information to our oversight groups. And then we will revisit the conversations around the future of the currently funded networks, as well as any new networks that will be in the scope for SPORE moving forward. So we do hope to be able to have some kind of more definitive answer early in the new year, because that's when the conversations will continue. We do have a message drafted that will be going out to all network leadership in the coming week, hopefully. We're just waiting for confirmation on its content. Don't have anything else. If there's any questions for me, please let me know.
Yeah, no, great. Yeah, I think CIHR has been very forthcoming in helping to keep us on, understanding various things that are going on. So that's been great. Thank you. Other questions? Sorry, I can't see specifically who isn't online. So, because it's on a lot of them are phone numbers. So I'm going to ask people to perhaps jump in. 613 is Ottawa. That must be Nancy. Kidney Foundation is on. Elizabeth, did you want to ask anything?
Hi, can you hear me?
Yes, we can. Yes.
Hi, sorry. Okay, good. I don't have any specific questions at this point. I just would like to congratulate you on your report. It does look like a lot of work that's been going in. I'm pleased to see the increase in funding year over year towards the research projects, and looking forward to the continued success and continued progress on each of the projects and hearing those as they come out.
Great, thanks. So let me ask the funders, especially our industry funders, a question. So we appreciate that your budgets for supportive research or supportive things are annual. And when we come to not just each year, but actually going forward with the with the next 5-year plan for CanSolve, how can we help you position this as an important investment that might be able to get traction for more than 1 year at a time? Anyone can start. I can't tell. Sorry, I can't tell where people are from, so. I've unmuted you. We're trying to unmute you all so that you can just start talking. I see Montreal.
Maybe I can ask a slightly less threatening question around that doesn't involve the pocketbook, but
oh, I see.
Perhaps people could offer some thoughts. Maybe Elizabeth, we could start with you at Kidney Foundation, how you think funders should be engaged in this next phase over the next year, where we think about new priorities and how we identify those through the planning committee. Should funders be represented on the funding committee? Should there be just more frequent check-in points around progress? How would that best be done?
Thanks, Bernie. Sorry to briefly miss any of the other conversation. I think definitely we would want to be involved in the and engaged in the process, looking at CanSolve 2.0. I think that the continued reporting, certainly I know as things have been, as projects have been getting off the ground, there's been a big lift and learning curve there, and I think the continued reporting is really important for us. I think as well, we would be looking at, I think we've got some learnings and some suggestions from the first phase, and some ideas, I think, about how Kidney Foundation can be leveraged not only as a funder, but some of our other expertise and how we can be involved at other levels as well in the project. So I think those would all be areas we'd be very interested in discussing further going forward.
Great, thank you. No, and I think that it's hard to get everyone in a room together, and so we're planning some core meetings, but I think that over the course of 2020, we would certainly want to meet with each of the current funders as well as anybody else that you might tag as Braden says, to really have a thoughtful conversation and work out how best to work with you going forward.
And we'd be happy to put together a funder-specific forum like this. We'll be doing one for the Kidney Foundation later this fall. And if others are interested, please get in touch and we'll organize something for you.
Yeah, Jim Scully speaking, just to make a couple of extra points that our funding partners may be interested in. One speaks to kind of the core values of the SPORE program, and the other speaks to oversight. One of the things that our network has done is to incorporate patient partners into the annual review process for each of the projects. So not only do the projects have partners that are on the ground, so to speak, but there's oversight that involves different patient partners, and they participate really quite effectively in that review process. Second point I'd want to make, and just to let our partners know, is that we actually seek and have sought international feedback. There is an international research advisory committee that exists for CanSolve CKD that meets on an annual basis, and indeed has been approached and provides feedback on the projects. This is gives us oversight from the United Kingdom, from Australia, and from the United States, so that when we rely on the considerable Canadian expertise, but we're also seeking that international view. And we want that international oversight to focus, of course, on the quality and potential outputs of the research programs, but we also want that international advisory committee provide us with opportunities for partnerships that go beyond the Canadian border. And I think those are two strong features of CanSolve CKD that I think might be important for our partners to know. And in any partner-specific engagement, would be happy to emphasize the key roles of both of those groups.
Thanks, Jim.
Hi, Dira. The 613 number is Deb Zimmerman.
Oh, hi.
From the CSN.
Yes, thank you, CSN. Would you like to say anything?
But it was actually a bit in response to Braden's comments about engaging or involving industry. And, you know, I've been peripherally involved in a number of the CanSolve CKD projects, mostly because of my role in the CSN. And it's been truly, as I know, I'm sure most of you can agree, is, you know, having patient partners in the room, changing and helping to direct research has just been a phenomenal initiative. But I wonder whether or not having industry partners where Braden was talking about this might also benefit from being in that same room during these conversations, because as we know, a lot of the discovery actually comes from industry, and perhaps hearing from patient partners will help direct their own program.
That's a good point, and I think there's always that, it's who from the various partners should be in that room, the scientific groups versus the marketing groups, and how we get them to come. But I think it's a great idea, and we should talk offline with each of our industry partners about how best to do that. I think that's a great idea.
It's Kathy.
Yes, hi, Kathy.
Hi. I just wanted to pick up on what Deb had talked about. And one of the things that, you know, having the industry partners and having the patients present there, because I think this is probably the one of the biggest impacts in terms of a bit of a change in research is that whole idea of having patients involved and everything right from the beginning. And certainly that patient engagement piece is crucial to ensuring that research is relevant to us as patients and as caregivers. And I really think that whole idea of telling stories with impact and being able to do that in a clear, succinct way. And that whole knowledge translation piece is really going to be crucial to engaging as many people as we can, but also having the right people we've always talked about the right treatment for the right people at the right time. And I think, that we can further go on and talk about having the right people in the room to be able to make sure that we can continue on with the work in terms of that. And I've just seen some wonderful papers that come from other organizations on patient engagement, and was wondering about, although we're getting the message out there to different groups in terms of doing presentations, is that we really need, and I'm not sure if we do that from an individual project level or from a in my way of thinking, we would do it from the CANSOLV level about patient engagement, because this project, all the projects that we're working on, have such an ability to be able to change the face of kidney research. And so I think we need to leverage our patients a bit more in terms of we're doing all this training and we're involved in all these things, but to be able to utilize our patients to be able to tell those impactful stories and be present and be part of the whole process moving forward.
Great. Thank you, Kathy. Well, I appreciate this is not the greatest forum for individual engagement, but I think it was incredibly important that, number one, we had this opportunity to talk with at least 10 of our various partners, from what I can tell from the people on the line, as well as meet and greet some of the key people involved in the network. But more importantly, for people to really have gone through that funding report, that annual report that was so beautifully put together, because I think it really says a lot more than we can say in 30 minutes or 35 minutes of a conversation. And I guess what I'd ask as a follow-up to this meeting, if individuals on the line would like to talk to any of us about further activities or clarifications, that please feel free to contact Heather. Her email address is on the last slide, but it's pretty simple. It's hharris@cansolvckd.ca. But really, we do want to figure out how best to continue to speak with you, not just to have conversation, but really to make some concrete plans and work out how we can work together in as much meaningful way as possible. So I think I'm going to end there, because I think we've accomplished what we want to accomplish, which is our annual update and renewed excitement about all the things that we have done and can do and will do. And as I said, please feel free to reach out to Heather, or through Heather to any of us, to have further conversations. So I'm going to thank everybody for making the time across the country to sit in on this, and for Graham and Leah and Linnea for all of their work on putting together the documents, and for Kathy and Mary for also making the time and presenting so well your components. So thanks, everybody.